Hello, it's Brooklyn Stantful, and this is my MSK Video Assignment. Today I'll be discussing the proper ergonomic techniques to prevent MSK injuries, starting with scanning posture, scanning technique, patient setup, and equipment setup. So sit back and enjoy. So we're first going to discuss scanning posture. So you want to use a chair that has good back support. Postural support devices can encourage correct positioning. This can eliminate repetitive twisting in the trunk. You want to use a chair that should be high, but only high enough so that both your feet can rest parallel flat on the ground. You can do this by moving the lever on the side. This will help correct posture and decrease MSK-related injuries. You want to use proper body mechanics, ensure the spine is appropriate aligned. This will train your ligaments, muscles, and tendons to relax in certain positions and make it a habit to think about when you're using correct posture. You want to use correct posture, which means all the body parts are aligned and balanced. Poor posture is often more comfortable than correct posture, however, it can cause painful muscle spasms. So proper scanning technique is vital. The more you practice good posture and technique, the more routine they'll become. So first we're going to position the equipment no more than 20 to 30 degrees away, or about an arm's length, to avoid reaching or twisting the trunk of the neck. This will reduce muscle fatigue results from applying force while carrying out these movements. When working on the computer, keep your elbow flexed no more than 100 to 110 degrees and keep your wrists in a neutral position. This will decrease your chances of getting a wrist MSK injury. Use no more than 30-degree angle of abduction. This repeated use of awkward abduction and adduction can lead to work-related muscular disorders. Position the non-scanning arm so the elbow is at 90 degrees angle and the upper arm hangs freely at the side. This is used when typing or annotating your images. So continuing on with patient setup, you always want to use assistive devices to move heavy items or patients and bend with your knees. For example, using a wheelchair. This will help reduce hurting the lower back while moving the patient. You want to ask them to scoot as close as possible. This will decrease arm abduction and allow for less strain on the shoulder and arm. Room design also includes lighting, air quality, and flooring. This can contribute to eye strain and complications. By allowing for the appropriate room design, it will decrease eye strain, which could prevent some repetitive injuries. So you always want to make sure the lights are dim so you can see the images better. A mask and face shield on due to corona, and make sure the patient also has their mask on. This will decrease your chances of getting COVID and keep everyone safe. And last but not least, equipment setup. You want to stretch before scanning because this helps prevent MSK injuries and prepares the muscles before the scan, normally holding for about 5 seconds each. Ergonomics is a scientific study of creating tools and equipment that help the human body adapt to the work environment. Here is an ergonomic chair that I am using. Next, you want to use cable support braces or shoulder assists to decrease shoulder injuries if you have them. Here I am using a cable hook to prevent tripping and possible injuries for the patients or the sonographer. You want to position equipment no more than 20 degrees away or about an arm's length to avoid reaching or twisting the trunk or neck. Any movement that requires the wrist to be taken out of neutral position reduces its strength. Be mindful of the repetitive gripping action. Sonographers can choose specific transducers according to comfort, handling, and maneuverability. Be aware of the transducers that cause you discomfort and make adjustments.